So, taking a look here, we have Genus 2.0, obviously. Claims to be the best of all natural ingredients, most advanced, 9 efficacious ingredients, basically everything that you would expect them to claim. Big note here is being free from jitters or crashing. Um, Got a cool design. I like the look of it personally. I like the black. Got your quotes from Tony Huge and all that you would expect. So let's break down its main claims. It claims to be an effective brain enhancing product. It claims to have reputable research. We'll take a look. Hours on end of focus and mental boost without a crash. We'll investigate that as well. Enhance mood, focus, and memory, and improve brain health. So that's essentially what they're marketing to you. It's supposed to have anti-stress properties, mental fortitude, which I'm not quite sure what that means, but I guess here they're talking about natural compound derived to treat and counteract Alzheimer's. So I guess mental health, like in the physical sense of brain deterioration. We have the supplement facts, so this is what we're going to be getting into primarily. Off the bat, what I'm seeing, and I'm going to go ingredient by ingredient. I'm seeing L-tyrosine at 1,000 milligrams. That is quite a dose of L-tyrosine. My typical go-to is about 750, but I'm not going to complain about 1,000 at all. It's my personal favorite nootropic product. If you don't know what it does, it's a precursor to dopamine. So your brain needs L-tyrosine to make dopamine. So at least my experience, when you combine it with any stimulant, whether it's caffeine, whether it's Adderall, whatever it is, it makes that stimulant better. We have here L-tyrosine. L-tyrosine to alleviate the effects of stress. The main effects of L-tyrosine have been reported are acute effects in preventing the decline in cognitive function in response to physical stress. So that's why you'd see it in like a lot of pre-workout ingredients. And I'm not going to go super into depth on all of this, just enough so that you guys can see what clinical literature does exist and like dig into it more if you want. Breaking down what it does there. Behavioral and cognitive effects on tyrosine intake in healthy human adults. So this explains what it is. And let's see. The buffering effects of tyrosine on cognition may be explained by tyrosine's ability to neutralize depletions of catecholamine levels. There is evidence that tyrosine may benefit brain-healthy individuals exposed to demanding situational conditions. For further research, we recommend moving from studying acute effects of tyrosine in small loads to studying behavioral and cognitive effects in larger groups. And up here, in contrast, studies employing neurological measures found tyrosine loading acutely counteracts dextromin in working memory and information processing. So it has an acute effect, and in an acute context, it is making you smarter, basically. Alpha GPC. This one got popular because video More Plates, More Dates did. I'm sure most of you are aware. Personally, I've taken it as well. If you don't know what it is, it's the only form of choline that breaks the blood-brain barrier. So choline is needed for overall health, but especially brain health. Dopamine and choline are going to be the two main drivers of focus. So any nootropic product should have a way to essentially give us more of that than what we would normally have. 600 milligrams, it's not the highest dose I've ever seen, but at the same time, my normal dose is 300 because anything, six works, but anything above 6, I get really cranky personally. Like, I don't know what it is. It makes me really snippy. 6, especially in an acute, I need to focus context, makes a lot of sense. And because there's 5 capsules in here, I can't highlight that. It's 5 capsules. You have a lot of wiggle room with these dosages. Starting 3 weeks after seizure, improved cognitive function, reduced neural death, and blood-brain barrier distribution, and increased neurogenesis. Alpha GPC is another one where, like, I'm not going to go. I think with L-tyrosine and alpha GPC, like, everyone kind of knows what it is in the nootropic space, so it's not really worth digging into. But yeah, that's kind of your basic stuff. We have 500 milligrams of ginkgo boba. And they are claiming, they being Enhanced Labs, popular plant ingredient used by many for its cognitive functions and brain health benefits, improve blood flow, reduce symptoms of stress, anxiety, and depression. Looking here, treatment effects, ginkgo biloba extract on spectrum behavioral and psychological symptoms of dementia, a meta-analysis. So this one, we're going to get a lot of the good stuff. This is a process if anybody wants to pause and read through. Essentially, we're looking at a meta-analysis involving 4 trials involving over 1,600 patients. Treatment duration was either 22 or 24 weeks. The dose was 240 milligrams in all trials. That's notable. Enhanced Labs product is twice that. So theoretically, you would expect double the benefits. They scored significantly superior on the EGB 761 over placebo in total scores and 10 single symptom scores. Regarding caregiver distress, patients treated improved significantly more than those in placebo, with the exception of delusions, hallucinations, elation, and euphoria. But basically, everything from behavior to cognitive ability was improved in people with dementia, except for hallucinations and delusions. So it's not going to cure dementia. This is a basis to assume that it helps with brain function overall. Next year, we're looking at the mechanisms and clinical interactions. Through all of it, you guys can pause, and it's all on PubMed. Like, none of this is particularly hard to find. I'm just, if we look here, Enhanced Lab, they cite, I think, 2 references. So, like, I like the company, and I'm affiliated with them. I'll have my discount code Improve or Die and my link in the description and everything. But like, there's a lot more references than just what they're citing, and that's kind of what I'm trying to do here. We see here the conclusion. It shows promise in treating those with neurological sequences associated with Alzheimer's, TBI, stroke, normal aging. That's very notable. That means there doesn't have to be something necessarily wrong with you for this to help. Edema, macular degeneration, well safe. Caution is advised when recommending it to patients with anticoagulants. So don't take it if you have anticoagulants. So this one's testing the acute effects in someone who had a stroke, randomized controlled trial. 134 patients enrolled, 169 of which were in a control. When combined with aspirin, it alleviated cognitive and neurological deficits after an acute stroke. So again, evidence that it works in an acute context. Very, very big. Yeah, it's going to improve mood function, it's going to improve brain health, and it's going to have an acute effect, but also help additionally over time. So this is a product, at least so far, that could be taken daily, but will still work immediately. Next up, we are looking at, I'm going in order of dosing, Bakuba Morana. I'm not even going to try. We're going to call that BME. At 500 milligrams. The claim is that this is an herb traditionally used for centuries with known properties to improve memory and cognitive function by increasing brain flow and reducing oxidative stress. Here we're looking at a meta-analysis, kind of the gold standard of evidence, really. Looking at 9 studies that met the criteria of using 159 subjects total. Overall, the quality of the included trials was low risk of bias, and the conclusion suggested that it has the potential to improve cognition, particularly speed of attention, but only a large, well-designed head-to-head trial would be able to determine if it would have efficacy in healthy humans. But overall, this is strong evidence that it's going to help primarily with the speed of attention. So like, I have ADHD, something that affects is essentially task switching, like being able to focus on one thing and moving to another. Something like this would probably be beneficial in that context. Here's one looking at it from cognitive performance, anxiety, and depression in elderly randomized double-blind placebo-controlled trials. As we can see here, it was placebo-controlled of 6 and 12 weeks. Volunteers in Portland, Oregon. 54 patients, 65 or older, with the average being 73.5, without clinical signs of depression. So it's important to note these people did not have dementia, they were just old. So this is going to be the closest type of study to probably use. So generally, the people buying this aren't old people looking for medication, they're young people looking to biohack their way into performing better. And we're not profitable to do research on, so the best we can get is healthy old people. So this is going to be the most related to you. This was dosed at 300 milligrams a day. Enhanced Labs has 500. So it's exceeding the research dose. but it's generally considered to be safe, so more benefit. Results showed controlling for baseline cognitive deficits. It showed participants had an enhanced AVLT, delayed word recall memory score, so faster memory. Stroke tests were similarly significant, with the group involving the supplement uh, improving while the placebo remained unchanged. Depression scores and anxiety scores, all heart rate, all decreased with the group taking the supplement. So good for stress, good for anxiety, good for depression, and the effects that can have on cognitive performance. So, in essence, what we're seeing in this study is a decrease in depression, a decrease in stress, um, and a decrease in anxiety and heart rate. So, overall, it's going to reduce stress, it's going to reduce anxiety, and it's going to help you if those are reasons that your cognition is suffering, which it probably is for most of us. On over to Uridine 5, we have this study. You guys can always pause and read through. This is essentially the nucleotides of uridine 5 in combination with B vitamins. And the results show more improvement and efficacy among subjects with the combined nucleotides, the supplement that we're looking at here. When combined with B12, it has superior effects on pain reduction, and it was effective in both treatment groups. So essentially, if you're taking B vitamins, which you should either be taking them or have enough of them in your diet, this will make them more effective. Looking on over here, we have another one, just breaking down normal stuff. Let's see. In such cells, uridine also enhanced the neurite growth output and produced more nerve growth factor, NGF, and the effect of a dietary supplementation with uridine 5 on straddled dopamine. So, dopamine in aged rats. Yeah, basically, a bunch of shit talking about rats to show it's helpful with dopamine modulation, which in turn will help with not only the L-tyrosine that's going to be making more dopamine, but just in general focus. Moving along next to our next ingredient, we have Rhodesia rosa root extract. We'll just call it R root extract. It claims to be an adaptogen that reduces stress and improves mental performance by increasing the production of serotonin and dopamine. Looking over here, we see that it has a long history of being used in traditional medicine to stimulate the nervous system, treat stress-induced fatigue and depression, enhance physical performance, and work productivity. So, traditionally been used for all of the good things we want. Apart from its well-established traditional use, a significant number of publications on clinical efficacy of R-Russia preparations can be found in literature. The majority of these studies are related to the efficacy in terms of cognitive functions and mental performance, including various symptoms of life stress, fatigue, and burnout. Beneficial effects of the medical plant on enhancing physical performance also have been evaluated in professional athletes and non-trained individuals. Moreover, even though most evidence is preclinical, several clinical studies have additionally demonstrated the remedying effects on the cardiovascular and reproductive health. Overall, in accordance with its aim, the results presented in this review provide an encouraging basis for the clinical efficacy in managing stress-induced conditions. So, in essence, this is it sounds like a meta-analysis, but it doesn't say that. Probably just a synopsis, but basically, here in the abstract, we can see that they've looked at a bunch of evidence and found that it reduces stress and anxiety and, to an extent, depression. So all of those good things. Also good for cardiovascular system, which is obviously important. Good for physical performance, which isn't necessarily something you need in a nootropic, but a lot of you would still benefit from. So that's definitely a good thing to have in there. Next two ingredients down, we're looking at methylbromine and teacrine. So these are very similar, so I have them kind of lumped together. I actually had to do some research and actually figure out what the fuck methylbromine was. Um, this the nootropic steepo. They're trying to sell you shit. So this isn't like the gold standard of evidence by any means, but it's if you might not have heard of it, then this will help kind of break down what it is and what it's used for, and then we'll dive into the more evidence based stuff afterwards. So essentially, they conducted some experiments. It's a pure alkaloid found in tea leaf, similar to teacrine. It's also similar to caffeine. So yes, in essence, methylbromine is a caffeine S compound. It's a stimulant. If we read through here, people often say when on its own, it's rather lackluster and not really what you're looking for. However, it's a has a less potent effect on heart rate, less jitters, less crash than caffeine would typically be associated with. And when combined with other stimulants like caffeine or potentially theobromine, you're looking at like more of the stimulant effect that you're looking for, with a relative lack of side effects, especially compared to caffeine. Short-term safety study here. We can go. You can pause and look through. Basically, it just says, at least in the short-term context, it does not pose any serious health risks, and it has similar neuroenginergic. Goddamn. Okay, full disclosure. I'm dyslexic as fuck, but similar brain stimulation effects to caffeine. Uh, if we look over here, what we're looking at here is the combination of caffeine, teacrine, and the supplement we were initially talking about. Here it shows that the combination of all of them is very effective in young male e-gamers. So this is a stimulant that could be used for gaming. So if you play competitive esports or really anything that requires that quick cognition, so if you're into like gaming, the combination of caffeine, teacrine, and this supplement here, methylberylene, we're looking at increased reaction time, increased focus, increased stimulation, less adenosine, which is the chemical in your brain that tells you you're sleepy. So we're looking at more overall focus. But again, on its own, this ingredient isn't super effective, but in combination, it can be quite powerful. Next up, over here, we're looking at teacrine. Very common to see in pre-workouts, very common exotic stimulant, very similar to caffeine, slightly different dosages. I remember listening to a podcast with John Meadows where he spoke very highly of it. It's in essence, it's a weaker caffeine without the jitters. That's pretty much what we're looking at. Dig through the clinical literature on teacrine, it just seems to do everything, like beneficial health effects, alleviates acute kidney injury, effects on pre-workout. It didn't actually show improved workout capacity, but if it's a stimulant, you're not coming to it to make you stronger. You're coming to it to make you more stimulated and focused. Alleviates liver fibrosis. Potent antidepressant. Like this is the teacrine just for Parkinson's. Like protects against non-alcoholic fatty liver disease. Like this teacrine does a lot of really good things for your overall health, and it also functions as a caffeine replacement. Last up, we're looking at huperzine A. Huperzine A is over here. It can be used to, let's see. Huperzine A alleviates obesity-related cognitive performance impairments involving fucking the insulin pathway in mice. So essentially, they have type 2 diabetes and rats with Alzheimer's, and it shows that huperzine A affects their cognition in a positive manner. Essentially, if your diet, at least what it shows in mice, is if your diet is affecting your cognition negatively, then huperzine A is going to have a very powerful positive effect in alleviating that. Essentially, it's filling a deficit. It's doing what a supplement is supposed to, because in theory, we all have perfect diets every day. In practice, what we eat sometimes hurts our cognition. Got another one here. For looking at alleviating Alzheimer's. You guys can dig through here if you want. The basics really is it shows improved cognition. It has improved cognition. It inhibits acetylcholinesterase, and it has non-cholinergic effects, but it also seems to have some interaction with the pathway, if I believe. This is essentially a breakdown of how it works. So yeah, and I remember actually reading a More Plates, More Dates article where he said that this also has a positive effect on growth hormone, at least when combined with certain peptides. But on its own, I'd imagine it would have a statistically insignificant but still present effect. So breaking it down, overall, Venus 2.0. What do I think? Well, the two ingredients I love that aren't in here are caffeine and theanine. However, this is not meant to have caffeine, basically. This is a stress reducing compound. Stress reducing nootropic formula. Personally, I don't get stressed on caffeine, but a lot of people do. Also, caffeine tends to affect people's sleep. So, this is something you could take at like 5, 6 p.m. and still be able to go to bed. Also, without caffeine, there's really no need for theanine, and that's kind of why it's in a lot of nootropics, is to counteract the caffeine. Other than that, I like all of the ingredients in here. It seems very high quality. All of the dosing makes a lot of sense. Essentially, it's working by supplying you with dopamine and choline via L-tyrosine and alpha-GPC. It counteracts the effects of stress on cognition. The first six or so ingredients do a good job of that. It counteracts the effects of being tired on cognition through the teacrine and the other one we were looking at. And it counteracts the effect of diet and obesity related cognitive deficits. So essentially, no matter what reason you're not operating at 100% capacity, this nootropic will help. And even if you are operating at 100%, it'll give you more of what helps you focus. So, yeah, overall, really good product. It's also dosed at 5 capsules, which could be annoying for some people, but I really like it because it lets you play with how much you're taking if you don't need a full dose. Overall, really good. Check out my link in the description if you're interested. Use coupon code IMPROVE-OR-DIE to get 10% off. I am affiliated with the product, but that did not affect any of my reviewing. And yeah, like, comment, subscribe. I'll answer any questions in the comments. Thank you for watching.